can perhaps move on to the next question if you'd like to pick up a card.
I'll give you the honours.
Okay, thank you. So, what makes a good boss and a bad boss?
I feel like,
So
yeah, where do you
like-
start, right? Yeah, I feel like we should let our registrar start this one.
Oh my goodness.
I might start with humour. We'll go bad boss first. I've personally worked for a boss for 3 months and they didn't know my name. And I think I think that one statement says it all. I think when it comes to, having a good relationship with a boss and a junior doctor, I think getting to know them as a human outside of, as you were saying, Dominic, oftentimes we just get labelled as the registrar or the intern, the medical student. And it's really dehumanizing. And I think when you make the effort as a boss to get to know someone, just those simple things, knowing their name, knowing a little bit about them, their background or their interests or what their aspirations are, you can just have such better rapport working with them going forward. And I don't know how you can really give good feedback or teaching to someone if you don't really know them on a personal level. I don't think you can just teach, this form of a person who you've labelled registrar or something without connecting to the human.
Yeah.
Otherwise it's just orders, and that's not why we're in medicine. Just to learn.
Can I ask a question around that? So as a younger person, if you're, and I'm thinking about this question because I work in our university clinic supervising the students, seeing people come in, and we've had a couple of medical students come in. And because these days, and I presume it's the same where you work, their senior consultants or their bosses have their mobile numbers. They, one young lass has taken a break, and she was quite bothered by having received at least 3 non-work related texts from one of her consultants. And I just wonder about boundaries, and I wonder where you as the younger person feel it is comfortable, how much you want your boss to know about your personal life and who you are. It's one thing to know your name and to encourage you and to support your professional growth, but how much do you really want them to know about your personal life?
I think it's of course going to be dependent on the relative power differentials and how long in terms of time you've spent together working. But I think that's a really important point. What I'd like to see is that for medical students and junior staff, how we start that relationship and how we start drawing that boundary is within work hours, within normal work activities. So getting a coffee. I think that's the best example for ways a boss can get to know the people working for them in a way that doesn't cross boundaries. And then, perhaps the sending people multiple texts on a weekend, if it's entirely unrelated, that might cross a line. But then for people who are working together, for a year or something, or know each other quite well, maybe that's quite appropriate. And certainly you can form friendships in those working relationships over time, but it's got to be something that where both parties have agreed to where the boundary is, whether that's spoken or not. I think it's a very awkward conversation to have, but
I agree with that, because I know for a fact that some people as trainees, we don't necessarily want to disclose a lot of personal side of things. Some people are more open about it and then wanting to talk about that with senior colleagues and bosses and so forth. But if it's forcibly built relationship, having to go through whatever that program might be, that forces that particular trainee to disclose very personal, sensitive things. That's not really, yes, it's you're disclosing that information and trying to build a deeper, meaningful relationship, but not necessarily coming from their heart and coming from their initiative. So I think in those circumstances, not necessarily it's a good way to go. So, starting with something as simple as that, work coffee and that sort of thing. I can speak from my personal experiences that, Dominique has been the mentor that I didn't have in the past, where I had a personal sort of difficulties or issues that I come across a few years back, and then maybe for another time I can talk about that. But I think in my mind, good mentors tend to be there when the junior staff or trainees needed help, and being able to listen to what their problems are and giving a nice gesture or a helping hand wherever they need them to be, and then of course within reasons, and just sort of empathize with that trainee or junior doctors, and being a support. I think that really tells me that yes, that mentor actually do care about that particular individual.
At what level of your training do you think that you have reached enough um, of your own self-awareness and your own empowerment to be able to be able to manage that? Because this was a student, so I think she was fourth year medicine, and the power imbalance was so diverse at that stage that she didn't feel that she could actually rebut what was happening. She really didn't know how to deal with it at all. I mean, she's at 22 and somebody around their 40s is sending them a sort of casual text simply because they have their number from a work-related issue. So could you talk a bit more about that, perhaps?
I think that behavior is entirely inappropriate.
Yeah.
I think there are very basic, fundamental human level connections that are defined by our professional interaction. And the way I see this is, my juniors are people, they have their own lives, they have their own families, and their performance is, in that role, in that job that I oversee or supervise, is a responsibility towards my patients. And even if you want it to be completely lacking in empathy or just, completely impersonal, it's really important to understand a person's social context, to understand or contextualize their performance in a job. So, I have come across many, many junior doctors who were labeled poor performers, or not very good, or rubbish, or, underperforming. And without an understanding of what it is that person is going through. And invariably, if you scratch the surface, you'll realize that, this person has some kind of event going on in their lives, or they have some past trauma that's impacted their performance, or they have family pressures that are unusual that are impacting their performance. So, that empathy, that appreciation that everybody has a life, everybody's unique, everybody has particular skills and talents, as well as responsibilities and lives outside of medicine, is just the basic principle. And I think that's very separate to crossing boundaries, like contacting, students on their cell phones. That's not okay. I don't know anyone who would think that was okay. Or, contacting a junior person without respecting that power dynamic. And sometimes in medicine, people don't respect the power dynamic, that is really quite a coercive relationship if you cross it, if you cross that boundary. And to be honest, I found that a very masculine trait, not knowing what is okay and what is not okay. There are no rules written, there are no guidelines written. So people can feign ignorance when this happens. Oh, I thought it was okay. The student gave me their number. You're a senior person. You should not abuse that power. And, I think that is something many clinicians in senior positions don't appreciate or understand.
Yeah, well said, Nada. No, really well said. Point taken.
To hear from people, at what level do you feel strong enough to be able to then, it's never going to be a reciprocal relationship, but at least be in that position where you can say, as you were just talking about earlier, having a coffee with them, chatting, maybe sharing, you've had a sleepless night because, the 2-year-old's been sick or whatever. where in that, how do you how do you inject that into the mentoring relationship and still keep respectful boundaries in place?
Yeah, I think it's a really challenging question for medical community because medicine, the way it's structured, it's so hierarchical and it is a form of apprenticeship essentially, where junior people are made to feel like your bosses hold the key to your future. And so, whilst we teach students and doctors how to behave in a professional manner to patients, and there's a lot that can improve in that space also, because there's not one definition of an ideal doctor and how they approach patients, but also I think there's just complete void or gap of how we as professionals interact with each other professionally and where the boundaries are. And the whole human value side of things is something that I feel really strongly about. I think as a junior person, it's almost accepted or normal for you to feel like you're less of a human than somebody with a professor title or somebody who holds some position in the board. But just because somebody's lived for a long time or had been in this profession for a long time, why does that make you a better human or more worthy human? And I think these are the things that we need to challenge. And it's hard to do as junior people, and that's where more senior staff like me and Nara and Dinesh, we need to challenge our peers. For them to, for the older generation to perhaps think a little bit differently, because whilst you're juniors and you're in training position, at the end of the day you're our colleagues. It's only a matter of years you will be a consultant, and so why do we treat you? I should again not say we, because I don't do that. Why do people treat trainees or junior people as if they don't have the same human value? Like, these are the things that really bother me.
I think it feeds into very patriarchal structure, of medicine, because it's your achievement that confers value. Your PhD, your consultant title, your job title confers your human value rather than your lived experience or your humanity or your personal or character strengths that confer value. And I see this all the time, even at senior positions, because you and I, Dom, we're challenging people, we're challenging the status quo. So it's very hard for us. The power dynamic actually becomes very difficult from, where we are, even between our seniors and our colleagues, and where we sit, because we challenge ideas and thinking and a lot of other sort of levels that, juniors are probably not privy to. But by the same token, I can see where people are considered less than, even at a senior level, if they haven't had certain achievements in their career. And that's problematic because the way medicine has evolved, because of the patriarchal structure it came from, or it still is. And I think it will require a little bit of dismantling to kind of start to look and talk about these issues around boundaries, about professionalism, about what constitutes merit, what constitutes personal value in medicine.
And I mean, that does bring us to, from the gentlemen in the room, it'd be nice to get some views from them regarding gender, because we do, although abuse can occur, from a senior female downwards, most of the abuse that gets reported tends to be around sexual misconduct from consultants on junior staff.